Okay, so this exercise is intended to act as a hip mobilization. And so we're gonna leverage the strap here. This one is a 3D strap, but anything that's non-elastic in nature will certainly do. The hip joint is one of the largest joints in the body, the largest ball and socket joint for that matter, and as such it requires a lot of force, and particularly concentrated force, in order to actually make meaningful changes at the joint level. And such that we're going to use a non-elastic band, and we're going to also leverage the cable system such that we produce sufficient amount, or provide a sufficient amount of force to actually add mobilization. This, in combination with the internal forces that are derived with the exercise through the muscle contraction, are going to be key in order to actually make meaningful changes within the soft tissue and within the joint capsule itself. Keeping in mind that the muscles, the deep external and internal rotators, tie directly into the joint capsule, such that when they contract and relax, and particularly in an eccentric fashion, adds tensile loads through the joint capsule, further helping our cause as to add mobilization and thus change the architecture of the joint capsule over time. So the orientation of the acetabulum is slightly in this 45-degree angle, and thus I want to meet that orientation with the line of pull. Depending on my height, or my limb height, will dictate the appropriate amount of height of the cable that I'm thus attaching to. So for me, this is as I step away from the cable, this will approximately be okay. As I orient the cable or the strap just like that. And you want it to be as close to your groin as you possibly can. The amount of weight that I often start folks with, just to ensure that they are responding to it appropriately, is about a 15% or so of body weight, anywhere between 20 and 30 pounds depending. Okay. And then the mobilization is going to be in a hip hinging fashion. So oftentimes I find it beneficial to have something stable to hold on to, such as a stick mobility dowel, where I'm going to start by getting a direct posterior glide, such that the strap is pulling me in a superior posterior direction. As I sit back into the strap, in fact, I actually need a bit more resistance. It's not nearly enough. All right, so that should be. Walk away, and then as I hip hinge down, I'm going to tilt the mobility stick away, and then I'm going to come up through. Okay. So because of the line effector is slightly off from the directly posterior, there's this obliquity. If I was to allow my pelvis to just be pulled by the cable strap, there'd be kind of a rotational moment. And that is okay, but the significance of that is when I come into my terminal extension of my hip, I'm actually going to assist with that into this diagonal. So the vector of force would be like this. It would be anterior to posterior with a slight obliquity. If I was to face the camera and demonstrate, it would be like this. That would be the line of pull and force generation. Usually I do this, I recommend going for time, as human tissue responds better to time under tension rather than just an arbitrary repetition count, where I will encourage people to go into it, hold for a 3-breath cycle. Big breath in, big breath out 3 times, and then you're pushing up at that diagonal, squeezing, and then slow eccentrically controlling it back. Again, the eccentric contraction is significant because the muscles will then pull on the joint capsule in an elongated fashion, facilitating mobilization of the connective tissue. I will then orient, instead of just directly away, I'll go into a 45-degree mobilization, or such that it hits slightly posterior and lateral. And then finally I will also go almost pure lateral, where I'm mobilizing again through that hip hinging motion, trying to get through a full flexion and extension mobilization at the hip level. This would ensure that I'm hitting all parts of the joint capsule and allowing for better improvement in hip mobility at the end. Now, obviously you can tailor this to what you feel as though your body otherwise needs. If you have certain directions or areas of stiffness within the joint capsule, by all means, spending more time on that specific location would be pertinent. Again, the bouts go for about 90 seconds per position. You can cycle through it anywhere between 2 and 3 times as needed. I find that I don't get as much relief if I stop shy of the point at which I'm not getting a good muscular burn within the glute itself.